Now, what I try to do here, and I think this is interesting, I try to list what are the major concerns for any investor who is looking for a balanced risk, high return in the biotechnology area. Well, first of all, it's diversification. We all know the cliche, never put all your eggs in one basket. Everybody wants multiple shots on goal, and we've addressed that. We have a portfolio of 7 companies, and these are companies in advanced clinical trials, so they are close to fruition. It's hard to bet on science. Science is very tricky, and we're not PhDs, so we can't really determine where the science will and where it will not work. Luckily for me, we're based on the world-renowned Hadassah scientific expertise, so that's a very, very comforting factor. We use Hadassah's infrastructure so we can bring down the cost of development from X to 1/10 of X. If I were to measure the cost of this portfolio and transfer it out of the hospital setting, it would have cost me tenfold to get these companies to the same point that they are today, because being associated to the hospital is very, very effective. We have great managers on the portfolio level and on the holding company level, and we have a clear exit strategy so that when the companies hit their milestones, we know we can sell them or license out to leading drug companies. Another point which we're very happy with is this ADR. It stands for American Depository Receipt. We were being asked, why aren't you listed in the US? People want to invest, people want to buy the stock, and the brokers wouldn't let them because it was traded only in Tel Aviv. But now if you check with any broker, there's a market maker. We work with the Bank of New York, so it's as visible and transparent as possible, and there couldn't be an easier thing than to buy, hold, hopefully never sell, but some people sell, I can accept that, these securities. And the price now and the deal flow that we're getting from Hadassah makes it even more attractive. Even if we set these 6 companies aside for a minute, I know that I have this engine of innovation, this huge amount of doctors and physicians and researchers that are generating more and more investment opportunities for us.